Putting on your everyday clothes seems like a mindless task, but working in the dental field, we have to put on something called PPE. It stands for personal protective equipment, and it keeps us and the patient safe and the rest of the dental staff. The four main elements of the PPE is your lab coat or gown, your mask, your goggles, and your gloves. First, you always put on your lab coat or gown. I use a sweatshirt because our area is usually pretty hot and the lab coats are really thick. This is kind of thin and lightweight. All the lab coats either have a zipper, buttons, or are tied on, so you just want to make sure that it's all the way zipped up or tied on, and that it covers your full torso. I actually also like this one because it kind of goes up to your neck, so I feel completely covered, and it goes all the way to your wrists, creating a full barrier freeze. Next, we get masks. There's 3 levels of masks. We use level 3 because we're around carcinogens and a lot of aspiration of blood and saliva. So when you put on the mask, you want to go over each ear loop. I do this trick where I put it over and I twist it. And this just adds a little extra ventilation so when I put on my glasses, they don't fog as easily. Next, there's this little nose band that's made out of metal, and it just kind of forms to your nose, and you just want to contour it so nothing can get in. Then you put on your goggles. Putting on your goggles is just like putting on sunglasses or regular glasses. You just want to make sure you're grabbing a clean pair of goggles because sometimes the chemicals we use leave a residue and it's really hard to see. So just make sure that they're clear. Just put them on like that. And then lastly, we put on the gloves. We put on the gloves last because this is the part that's you're going to put in the patient's mouth. You don't want to touch the fingertips at all because that's the whole part going in the patient's mouth. And you also want to make sure that when you're grabbing it, you're grabbing them out of the box by the end. So when you put your gloves on, they don't need to be perfect at first, you just put them on. And now when you have both gloved hands, you kind of can adjust everything. And you make sure that the gloves go over your gown, again, creating a full barrier for yourself and the patients. This ensures a sterile environment for them and for yourself. So removing is the exact same way, but opposite. You always remove your gloves first. By removing your gloves, you take and pinch this. You take it off, crumble it up in your hand. You slide your finger underneath here, not to touch the contaminated area, and you roll it. So now you can touch this because it's only been on your hands. Next, you take off your glasses, making sure not to touch the outside because that's the part that could have the blood or saliva. Then you take off your mask by taking one part off like this, and then you take off your gown. Some gowns you can throw away, and that's a different step. You take it off at the beginning, but this one I just hang up, and I always make sure to wash my hands and sanitize at the end because you're touching it to get it off. But it's very important to do it like that every single time to ensure my safety and no spread of disease or anything, and to ensure the patient's safety. If you put on your gloves first to put everything on, you're touching all of that, and that is so many foreign objects that's already going to be in the patient's mouth. So that's why it's important to do it every single time. Thank you.